Hi guys, today I'm going to discuss a very important, very common and one of the best topic among the community, among the people is the diet in relation with the high uric acid in gout. A public by and large misled by those people who are not actually the doctors, and YouTube is flooded with a lot of information. So many non-medical persons are talking about how to manage uric acid in gout, which is something very ridiculous. I understand the dietitians recommend a lot of things, but as a rheumatologist, what I understand, there should be a right information to be shared with the public, with the patients. Because today I'm not talking about why hyperuricemia, what happened with the gout. It's just about what are the foods and what is the justification as per the guidelines. I do feel sometimes the nutritionist and some those non-medical persons exaggerate the things. Just I say they want to say you that completely off the meat products, which is not fair. So, as far as concerned with the diet, what is the most, the things which contain high amount of purine, obviously, which is the end product, uric acid. So one of the most important things are the things which contain or the, high amount of the purine is the organ meats. For example, if you are taking a liver, you are taking the kidney, you are taking pancreas, thymus of any of the animal origin, so the organ meats, these organ meats contain more purine compared to the general meat, the muscle portion. And among this, another things which are the some fishes, the sea fish, the seafood contain like mussels, like a trout, haddock, and scalloping. They contain slightly high amount of the purine, and then obviously they may develop more high uric acid compared to the standard mutton or beef. Obviously, bacon, salmon do contain more amount of the purine. Along with this, as the research study suggested, if you completely stop like the meat and all these products, only 1 milligram of the uric acid will go down. So having said that, you do not need to completely eliminate or stop the protein intake. Yes, just to take in the minor amount, and interrupt it. Along with this, there is another associated things like people may forget about, or the people only focus on the meat and the protein. But some of the other things like the carbohydrates, more sweet, more sugary foods. Now, all the sugary foods, sugary drinks are particular, like these fructose contained, like those fruits which contain high amount of fructose, high amount of mono sugars compared to the carbohydrates, which are complex carbohydrate is a less risk, but isolated high amount of sugar, fructose corn syrup, all the beverages, all sweet drinks should be avoided maximum. So on the one arm, restrict animal protein and particularly the organ meats, but you can take normal interrupted portion of the normal meat. Along with this, these all sweet containing beverages should be avoided, and obviously you will have a benefit in the other aspects as well. But what happened when people are talking about the protein diet? Like I have heard a lot, and particularly in the Asian continent, the dietitian restrict every kind of the protein. Now, a lot of time people think about the pulses, legumes, lentils to contain the protein, but as long as they don't pose the risk, any plant, vegetable source protein do not contain any serious threats or development of the attacks of the gout. But having said that, when there is a people who have established gout, they go on the medication, then such strict dietary measures should not be encouraged, or there is no such data showing that if you have a gout, if you are taking particular drugs like allopurinol, febuxostate, or other urate lowering therapy, still you need a strict diet. There's no such way. As I said, only 1 milligram of the uric acid will lower down by all the diet. So if there is a 9 mg, 10 mg, so it doesn't mean that only diet can help you. For example, a lot of time the dietitian and the non-medical persons do not know. For example, if you are on a thiazide diuretics and your uric acid is high, you are stopping the meat, you are stopping all these things, but you are not stopping thiazide diuretic, then this is the one of the important thing is stop the drug, change the antihypertensive, your uric acid will be go fine. A lot of time people are maybe undiagnosed, misdiagnosed. If there is a hypothyroidism, if hypothyroidism is undiagnosed, untreated, then uric acid is goes high and you are treating or you are doing a lot of excessive dietary modification, but you may have underlying hypothyroidism. So that's the point, like people follow just the diet. The diet is very important, protein is very important for our body. If you remove the protein, your diet is not very good, like palatable. That's the important thing. Everything has its own benefits and risks. If you completely eliminate the protein, obviously there's also not the good thing. So coming back to the point, this is very important. A lot of drugs can cause high uric acid. So rather to think about the drugs, because non-medical persons don't know about furosemide is one of the diuretic. It's important drug, I know it's important for the heart patients, but it can raise the high uric acid. Thiazides can be replaceable by the other antihypertensive medications. There is cancer drugs, aspirin, which is one of the common medication. If you are using the aspirin for a strong risk factors or a strong evidence, this is fine. Some people may not need the aspirin because low dose aspirin can cause high uric acid. So these are the things which should be addressed while you are addressing the dietary modification. Now, a lot of people now think about these are the diets which cause high uric acid, and you can take these things which can lower. Again, I think a lot of people talking about the cherries and cherries. There's no any hard evidences for these studies, but yes, if you can take, it may help. Vitamin C, a consistent basis on the regularly, it can make a certain changes of uric acid to decline. Vitamin C. So vitamin C you can take by supplement or through the all vegetable, all fruits. You can search about. Fibric acid, fibrates can do help to decline the uric acid, and so this is all about that you should limit and use in judicious, neither to completely stop the protein, neither take too much. Obviously in asymptomatic cases, those patients or those people who have a high uric acid without evidence of the disease, we tend not to add allopurinol and febuxostate. But there are a few studies, very few cases when there is a high uric acid, it poses the threat to the joint because the crystal deposit, and if there is ultrasound and MRI, there is a damage. Obviously high uric acid, if above 11, then it must be treated by dietary, by medications, because it poses threat to the kidney and it causes kidney stones and kidney damage. So as an individual based lifestyle, obviously if you are obese, if you don't lose the weight, and if you just try to go on a medication, again that's not very important. You lose weight, dietary measures, lifestyle, drugs, and all should be in moderation. Daily 8 glass of water minimum should be encouraged to drink, which also help it. So I hope this video is informative. So what I need to talk is all evidence-based medicine. Kindly subscribe and share my YouTube channel. Thank you.